All right, good afternoon, everybody. My name is Ricardo Romero Morales. I'm a lead public information officer with the County of Santa Clara. Today, we thank you for being here one more time, and today we'll be providing an update regarding COVID-19 boosters. We're honored to be here with Dr. Sara Cody, our Santa Clara County Public Health Officer, as well with Dr. Marty Fanserchak, who is also our health officer for testing and vaccines. We will start this press conference in English, then we will move into a questions and answers section. After that, we'll have the statements from the podium in English, Spanish, Vietnamese, and Tagalog. All right, without any further ado, we'll start with Dr. Sara Cody.
Good afternoon, everyone. As you know, last night, the CDC officially recommended COVID-19 vaccine booster shots for all J&J recipients and many recipients of the Moderna vaccine, as well as green-lighted the mix and match booster strategy. So I want to acknowledge that people have many questions about boosters, and I think that's in part because there are 3 different vaccines, 2 different time periods, and many eligibility groups. So I want to give the public a simple message and also break down some of this complexity. So here's the bottom line. Most people who received an initial series of the COVID vaccine are now eligible for a booster, and for many of these people, a booster is strongly recommended. So let me say that again. Most people who've been vaccinated with an initial COVID vaccine series are now eligible for a booster, and for many, a booster is strongly recommended. So now I want to break down a little bit of the complexity for you. Boosters are recommended for everyone 18 and older who had a J&J shot. And they need to have had the J&J shot at least 2 months ago. They can be boosted with any vaccine, Pfizer, Moderna, or J&J. Second, boosters are recommended for a very large number of people who are 18 years and older and are at least 6 months out from their Pfizer or Moderna vaccine. And they can also be boosted with any vaccine, Moderna, Pfizer, or J&J. So for a subset of those who received the Moderna and Pfizer, the vaccine is especially important and we strongly recommend it. And those people are anyone age 65 and up, anyone age 50 and up who has an underlying medical condition, and anyone 18 and up who lives in a long-term care facility. Those are the group for whom we strongly recommend they go and get a booster shot. But in addition, I just want to say that a much larger group, a very large group of people are eligible for a booster shot. And just to try to simplify it a bit down, that large eligible group includes anyone who's 18 years and older and has an underlying medical condition, or anyone who's 18 and older and works in or lives in a setting where they may have increased risk of exposure to COVID-19. So all 3 vaccines have been approved. All 3 vaccines are available at our many county vaccination sites, as well as at many pharmacies, community sites, and doctors' offices. For more information and additional detail, you can always go to www.seccfreevax.org. Thanks. And Dr. Fensterscheib and I are happy to answer any questions.
We will call on everyone individually. We'll start over here with KCBS.
Dr. Cody, can you talk a little bit more about specifically with African Americans? I think I saw something on the website for the county about the fact that some particular groups, I forget how it was worded, if you were over 50, but you didn't have an underlying health condition, that there were some particular groups
Sure, I'll start and then I'll invite Dr. Fensterscheib to chime in. The question was about other groups 50 and up who are recommended to have the booster shot. And so the idea is that any group or any person who may have increased risk of exposure due to their occupational setting or their institutional setting or community setting or whatever are eligible and recommended to have a booster. So this may include, this may include anything from people who work in the grocery store to people who work in healthcare settings. I don't think that there are specific recommendations based on racial ethnic groups, but there's also a significant amount of overlap that may increase someone's risk of exposure and make them, more both eligible to get a vaccine or where they may wish to go ahead and get that booster. Dr. Fensterscheib?
Thank you, Dr. Cody. I think the issue is really who's at highest risk, not so much what type of group. CDC was very explicit about making sure that we really emphasize that 65 and older need to have that booster and should be boosted as long as you're 6 months out. And those that are 50 and older, basically, if you have underlying conditions. So that could be anything. So people who have diabetes, people who have mental health issues, people who are overweight, all of those conditions are included. So we highly, highly recommend that the vaccine be given. Again, one other thing to emphasize again is that the boosters are just for people 18 and older. So I know there's been questions about what about my kids 12 to 17. No recommendation, no indication for any of those 12 to 17s to get boosted at this point.
San Jose Spotlight?
Oh yes, when does this start? How soon does this start?
Booster shots are already being given at our county sites. Both Pfizer, J&J, and Moderna are all available at all county sites.
Carolyn?
The Pfizer booster's been available for almost a month now. What has been the reception? People who've been eligible for Pfizer, have been getting it? If not, why does that concern you, and why do you think that is?
So in Santa Clara County and across the state, the uptake of boosters is not what we anticipated. We anticipated a much swifter uptake in boosters. One possible explanation is that the public is confused about who should get a booster. That is the reason that we're here today to let you know that one, doesn't matter what your initial series was, you're now eligible to get a booster. Number two, if you're 65 and up, we really want you to get out there and get your booster. We strongly urge you to get your booster. And number three, as Dr. Fensterscheib said, the groups who are eligible is very, very, very broad because the list of underlying medical conditions includes everything from being overweight to having high blood pressure, to having depression, to having diabetes. And so that includes, frankly, most people who are 18 and up then would be eligible for a booster.
If I could follow up on that, we also keep hearing a lot of the messaging continues to be, not necessarily for you, that the two-dose vaccines, the mRNAs, as they are, prevent severe disease and death. And so with that constant messaging going on, there are a lot of people who are thinking, well, if that's the case, that's what I'm worried about, then I don't need a booster. What do you want to tell people about that?
What we now know about the vaccines is they're very safe and they're very effective, and the protection has waned over time. And that's why boosters are now recommended, particularly for those who are at highest risk of hospitalization and death.
NBC?
How are we doing for local supplies for the vaccines if people want to make sure they get the same vaccine that they got initially? And should people anticipate any kind of reaction or different kind of reaction if they do in fact mix the vaccines?
So there was a study that the National Institutes of Health did, and not a large study, but a good study on mixing and matching. And so that they found that it didn't really matter which vaccine anyone took as their booster. It seemed to be just fine as far as safety concerns are. We have plenty of vaccine that's available. Should mention one more fact, that the Moderna booster is half the dose of what the full dose was when you got the primary series. So on one, that basically expands the amount of Moderna we have for boosters by 2. So we'll have twice as much vaccine, since we're only going to be giving the half dose vaccine, and that's what was authorized by the FDA and the CDC. So if you did have a Moderna, or you choose to get a Moderna vaccine, you're going to get a half dose, which has been shown to be very, very effective. And with that, we don't know whether you'll have less reaction, but it's less vaccine, there may be a less reaction. And then one other question that was just to follow up on yours, we were looking at the data. So we're looking at 4 out of 10 65 years of age and older who have gotten, who are eligible, have received their booster. So only 4 out of 10 so far. So we really want to make sure that the message gets out, that other 6 out of 10 who are 65 and older and at higher risk go get their booster.
But that 10, is that 4 out of 10 people who have been eligible up until yesterday, or is that 4 out of 10 those who are eligible today, because you just added all the Johnson & Johnson and Moderna people today, yesterday. So is that 4 out of 10 just the Pfizer people who were eligible, or is that everyone?
It's 65 years of age and older who are now eligible, meaning they are 6 months out and had completed their 2-dose series. So it's based on the population of people who are 65 and older. We don't care what vaccine that they had. They are now eligible. And then tomorrow and the next week, more people will be eligible, because will be another, they will get to their 6-month eligibility. But for today, if you look at the 65 and olders, 4 out of 10 have had their boosters. So we're missing 60%.
So Dr. Marty, we've heard that it's okay to mix and match, but is it painful to? I mean, it seems like when Dr. Cody talked about some of the confusion that people have, I've heard from a few different health professionals, maybe it's not favorable, it's okay, but maybe not the way to go.
Yeah, the CDC is not making any recommendations as to which vaccine you should get. They're basically saying those vaccines are all safe, they can all be mix and match, and the individual can make their own decision. So mRNA vaccines may be a higher risk for somebody that had it and wants to go with a different vaccine, and vice versa with a J&J. So it really is something that the person individualizes with their own physician, but all vaccines are safe and effective. No recommendation by the CDC on one vaccine over another.
We'll go final question with NBC.
I actually had not heard that the Moderna dose was only half that was required. Why is that? And that would seem to be a good thing to push to get people who might be reluctant. But why is it that they only require half a dose of Moderna?
I think when they did the study initially, they looked at the 2 levels of doses, and they got they got a good boost out of the half dose. And I think the sense is, my own opinion, that they basically wanted to go with the lowest dose that was just as effective, and they basically could use the half dose. So the expectation is potentially less reactions, less side effects from that half dose, but it's a good dose. You shouldn't just say, I'm only getting half. Maybe it's not as good. It's just as good at half dose.
And one more final question from KCBS.
Can you guys just elaborate a little bit more on the process of getting it out there? I mean, the testing was really easy, drive-through at the fairgrounds, that sort of thing. Is it still making it, you think it's going to be just as smooth when people do start to turn out?
It is easy to get a boost of COVID vaccine here in Santa Clara County. We have multiple county sites, large, small, and everything in between. To get your booster dose, any type of vaccine, go to sccfreevax.org and make an appointment. There are some walk-up appointments available at some sites as well.
Just since we're running, I'll just take an opportunity to say that there are still nearly 180,000 people in this county that have not even gotten their first dose of anything. So I think even as the CDC has said, we really want to emphasize, as we're talking about boosters, there's 180,000 people who haven't gotten the primary series. And again, those people are going to be at the highest risk for infection and bringing more potential risk to others in the community. So please, if you haven't, it's safe. Do yourself a favor, do your family a favor, and the community by getting vaccinated. And then finally, get a flu shot.
All right, thank you so much, Dr. Marty and Dr. Cody. That will conclude our press conference in English. We will then now start with Vietnamese. We'll introduce Như-Hanh to the podium, ask her to do a statement from the podium in Vietnamese. Thank you.
Thank you, Ricardo. Kính thưa quý vị, chúng tôi là Như-Hanh, là nhân viên truyền thông của quận Hạt. Hôm nay chúng tôi xin đưa ra cái thông báo như sau. Tối qua, cơ quan CDC đã chính thức thông báo khuyến khích người đã được tiêm ngừa COVID-19 với thuốc của Moderna và của J&J có thể tiêm thêm liều hỗ trợ. Như đã dự đoán trước đây, tiêu chuẩn dành cho những người đã tiêm thuốc của Moderna cũng giống như những người đã được tiêm với thuốc của Pfizer. Và những người được tiêm liều thứ hai của Moderna hoặc Pfizer ít nhất 6 tháng trước đây hiện đủ điều kiện để được tiêm thêm liều hỗ trợ nếu họ đã được 65 tuổi trở lên, 18 tuổi trở lên và sống trong một cơ sở chăm sóc dài hạn, hoặc là 18 tuổi trở lên và có ít nhất là một tình trạng bệnh lý tiềm ẩn, hoặc 18 tuổi trở lên đang làm việc hoặc sống trong một môi trường có nhiều rủi ro như là công nhân trong ngành thực phẩm và nông nghiệp, nhân viên tuyến đầu, giáo viên, nhân viên y tế, vân vân. Quý vị có thể lên trang mạng của Sở Y tế để có được những cái định nghĩa đầy đủ hơn. Và tất cả những người đã tiêm ngừa với thuốc của J&J từ 18 tuổi trở lên và cách đây ít nhất chỉ 2 tháng thôi, hiện cũng được khuyến khích nên tiêm thêm liều hỗ trợ. Tất cả các liều hỗ trợ đều có thể tiêm khác nhau. Nếu như quý vị đã tiêm một cái liều thuốc trước đây, tiêm một cái liều thuốc khác thì bây giờ quý vị có thể tiêm một cái hiệu thuốc khác. Cho đến ngày 21 tháng 10 chỉ mới có 74.290 cư dân hạt Santa Clara đã được tiêm liều hỗ trợ, tức là khoảng 25%. Thì nghiên cứu cho thấy các kháng thể từ loạt thuốc tiêm ngừa ban đầu đã giảm dần theo thời gian và với một cái liều hỗ trợ có thể tránh được nhập viện và tử vong một cách hiệu quả hơn. Theo hướng dẫn của CDC, những người từ 18 đến 49 tuổi có bệnh nền cũng như những người có nhiều rủi ro nhiễm COVID-19 vì nghề nghiệp hoặc là vì môi trường sống đều đủ điều kiện và có thể đi tiêm ngừa liều hỗ trợ. Các liều hỗ trợ cho cả 3 loại thuốc tiêm ngừa hiện có tại tất cả các địa điểm tiêm ngừa của quận Hạt. Nhiều địa điểm tiêm ngừa khác như các hiệu thuốc, các phòng khám cộng đồng và văn phòng bác sĩ cũng có tiêm liều hỗ trợ. Xin quý vị hãy vào trang sccfreevax.org để lấy hẹn hoặc tìm một địa điểm thuận tiện cho mình. Và quý vị cũng có thể gọi số 408 970 2000 để lấy hẹn. Như mọi khi, tiêm ngừa hoàn toàn miễn phí cho tất cả các bệnh nhân đủ điều kiện trong mọi tình trạng di trú và dù có hay là không có bảo hiểm. Xin cảm ơn.
Thank you, Như-Hanh. Right, we will now move into Spanish portion of the press conference. Hola, buenas tardes. Mi nombre es Ricardo Romero Morales. Soy oficial principal de información pública para el Condado de Santa Clara. Anoche, los oficiales de la CDC anunciaron la recomendación acerca de las vacunas de refuerzo para todas las personas quienes recibieron la vacuna de Johnson & Johnson y para muchos quienes recibieron la vacuna de Moderna. También dieron luz verde para poder mezclar las vacunas entre Johnson & Johnson, Moderna y Pfizer. Sabemos que hay muchas preguntas en nuestra comunidad. La información en estos momentos puede que sea un poco confusa. Es por eso que estamos aquí para responder a sus preguntas y tratar de clarificar ciertos puntos. Lo que queremos recalcar el día de hoy es que la mayoría de la gente quienes recibieron su serie de vacunación contra el COVID-19 al menos 6 meses atrás, el día de hoy ya son elegibles para recibir una vacuna de refuerzo. Y para muchos es extremadamente recomendable. Para proveer más información, lo que podemos decir en estos momentos es que las vacunas de refuerzo son recomendadas para todas aquellas personas quienes recibieron la vacuna de Johnson & Johnson y quienes tienen 18 años y que la recibieron al menos hace 2 meses. También estas personas pueden decidir qué tipo de vacuna de refuerzo quieren recibir. Pueden recibir Johnson & Johnson, Pfizer o Moderna. Ahora, cuando estamos refiriéndonos acerca de aquellas personas quienes recibieron la vacuna o su segunda dosis de la vacuna de Moderna, también tienen que haber pasado ya al menos 6 meses desde que recibieron su segunda dosis. Tener más de 18 años y es en estos momentos recomendable que especialmente para aquellas personas quienes tienen 65 años o más o quienes tienen 50 años y tienen alguna condición médica, o también para aquellas personas quienes tienen 18 años o son mayores de 18 años y viven o trabajan en un lugar donde estén expuestos al COVID-19. También aquellas personas quienes recibieron Moderna podrían mezclar el tipo de vacuna que ellos quieran recibir para su vacuna de refuerzo, ya sea Johnson & Johnson, Moderna o Pfizer. Aquí en el condado de Santa Clara ya estamos administrando las vacunas de refuerzo. Todos nuestros sitios ya están proporcionando estas vacunas, incluyendo nuestros sitios masivos, al igual que nuestros sitios de momentalos, o más pequeños, los cuales no se requiere una cita. Para que usted pueda encontrar un sitio cercano a usted, puede visitar nuestro sitio web, el cual es sccvacuna.org, o también puede llamar al 211. Gracias. Right, we will now go ahead and transition into the Chinese portion of this press conference.
大家好，我是圣塔克拉拉县紧急行动中心的 Chang。圣塔克拉拉县新冠肺炎加强剂除了目前的辉瑞疫苗之外 ，CDC 已经批准其他疫苗的紧急使用，已经开始为完成莫德纳和强生疫苗接种的民众来施打加强针。加强剂是可以混打的，不一定要跟之前所打的品牌一样。想要接种加强针，必须是在至少6个月前完成最初莫德纳系列的疫苗，和至少2个月前接种强生疫苗的民众。CDC 和 FDA 对于符合接种加强针的条件做出了指引，包括了年满65岁以上的民众，还有年满18岁以上有潜在健康状况，或者是住在长照护理机构的居民，或者是在高风险环境下居住或者是工作的民众。符合条件在圣塔克拉拉县居住、工作或上学的个人，都可以在县内5个大型还有多处小型疫苗站来接种加强针。有许多疫苗站也接受没有预约的患者。此外，在许多诊所和药局也都提供新冠肺炎加强剂的施打。县府为公众所提供的疫苗接种都是免费的，不需要保险，也没有移民身份的要求。加强针为了为因年龄或原本就有健康状况而对新冠肺炎并发症有较高风险的人提供了额外的保护。强烈鼓励65岁及以上的人、长照护理机构的居民，还有50岁以上并有潜在健康状况的人接种加强针。年龄在18到49岁并有潜在健康状况，以及因为职业或工作的关系而有较高新冠肺炎风险的人，也符合资格，并且可以考虑接种加强针。更多安全、免费还有便利的疫苗讯息和疫苗站的地点，请上圣县疫苗网站 @cc.freevax.org。最后，祝大家平安健康，并有个愉快的周末，谢谢。